Hey guys, it's Dr. Ashley here from Head to Toe Spine and Sports Therapy. Today I wanted to talk about common kind of muscular tightness, muscular pains that we can get with squatting motion. So whether you're trying to PR in your squat or doing heavy volume of squat, whether you're a CrossFitter or just, somebody that does normal recreational activity, these releases that I'm going to show you apply to anybody. So commonly what we see, especially with people who are doing a lot of these motions, is we get a lot of tight hip flexors through the front of the body here. It's pretty obvious why that would happen, right? In a squat motion, we need a lot of hip flexion, right? In this motion. And if we're compromising form in any way, right, especially at the low back, say if we're overly extending, right, or even if we're overly rounding here as we try to squat down, that puts a lot of stress and tension on this hip flexor muscle. And there's multiple ways that we can release it. You can use the release as a prep kind of thing, so like pre-workout. You can also use it as a post-workout tool as well, just to kind of calm everything down after a workout. So what we love to use the most, lacrosse ball, a very trusty tool. If you've been in the clinic before, you've probably seen us show you this like a million times over. But I'm going to show you again anyway, because you guys probably don't utilize it as much. So what we're going to do, we're going to get down on the floor, a little bit of anatomy here. We want to place the ball generally to start on the inside of your pelvic bone here on the front, right? So if you just kind of palpate your belt line, kind of drop the fingers down about an inch or two, you're going to find that area. We'll take the ball, we'll place it on the inside of that, and then we're going to get down to the floor and lay right on it. So if I find that spot for myself, just place it right underneath. And then I just like to tell patients to just kind of relax in this position. The more you relax, the better the release is going to be. For those of you who don't get as much pressure in with this position, a very common way that we get release on that same side knee, and then you can take the pelvis and push it down into the floor a little bit and just kind of hold that position. You can also just kind of rock in and out of that. Hopefully you guys can see that very well. So we want to chase the tender spots. We want to make sure we're not feeling any numbness or tingling. And you don't want to do this for about 2 minutes. For those of you who are too sensitive, you can always drop that time frame down to about a minute, maybe 30 seconds, whatever you can tolerate. Another thing worth mentioning is how long the muscle is. So obviously we're just starting in this one area, but you can go as far up as your belly button, and you can go as far down as kind of this groin line here in this V area. So just kind of scan through once you get on the floor, find those tender spots, find those trigger points, and try to release them with the lacrosse ball. If you need a little bit more pressure, we've used this. This is called a Pso-Rite, and it's a nice kind of raised structure here, raised half pipe to kind of get your hip flexors released. If you don't have something similar to this, take the lacrosse ball, you can prop it up on a yoga block, right? And then it just gives you something to lay over, so you can get a little bit more of a release in there. So it kind of lifts the hips up, and then gravity can kind of push your hips down onto that surface to get a little bit more of a release there. So 2 different ways to do that active release. The last thing I want to show you is just simple hip flexor stretches. And you guys have probably already seen this before, but the form is where we can get a little sticky with it. So we'll start in this half kneeling position when it comes to hip flexor stretching. You guys have probably seen this before. The biggest thing that people do wrong is that they just get in this position and lean, right? We don't get too much of a stretch through this hip because we have too much of this extension in the pelvis and the low back. So easy fix for that. Take your pelvis, and we're going to do what we call pelvic tuck, right? So you just take the tailbone and tug it towards your face. And then from that position, you should already feel lengthening through this hip flexor. And then all we're going to do is just lean slightly forward. And that's going to give you way more of a stretch than just doing this. From here, you can take your foot, angle it outwards, lean towards one direction. You can kind of work in like this diagonal pattern, getting from the front to about a 45-degree angle this way. Okay, so whether you use those two in conjunction with one another or separately, it's going to be a great way to release those hip flexors. If you need a little bit more help with it, have us dig in there, just go ahead and give us a call and set up an appointment.